The term beauty is only skin deep is so true, but it's like we live in such a superficial world. We're all subjected to it. You know, we can't escape it. So it's like that internal fight. It's like, okay, I embrace myself and I'm powerful and I'm this and I'm that. But then it's like, but I do want to be perceived as beautiful. So Dr. Mina, I'm hoping that she can help me because the hair growth is getting worse. It's not getting any better.
Hello, is it Charli?
It's Charli. Yes.
Nice to meet you.
Nice
I'm
to
Dr.
meet you as
Lopez. Hopefully you do handshakes or do you have fish bumps or?
I'm all for it.
All for it,
Everything, yeah.
whatever the case may be. Yeah. All right, well, I'm gonna have a pop squat here. So what brings you in today?
I have excessive hair growth, which is why I'm wearing a mask right now.
Okay.
I don't want to show anybody. And then my hair on my head is thinning so bad.
Okay, so I'm gonna have you remove your mask.
Okay.
And we'll see what we are dealing with.
Okay. You guys are the first people that are seeing me like this. It wasn't just like a little bit of hair I could shave. It's coarse, it's thick, and if I shave at 7 in the morning, by noon, you can see it coming back. It's like a mental game at this point. I think everybody's looking at me, and they're not looking at me for me. They're looking at, oh, that's the girl with the beard.
Clearly, my 3-year-old is aware that I have a hairy beard.
Having this facial hair and having a loss of like my actual hair is affecting every single aspect of my life. Me being a mom, me being a wife. I don't even want to kiss my husband. He didn't sign up to like kissing as a wife and like be like poked by facial hair.
I can feel it like on my bare skin. I can feel it.
I can't even like feel feminine at this point. I don't feel pretty. I just want to like be comfortable and be happy again. So, and I want to be able to look in the mirror and be happy at what I see, and I just like, I don't.
Okay. It's bright, very bright, my friend.
And look how far down it goes to on my neck.
It does.
Yeah.
It does go all the way down.
I can see that she's had a hard road with the amount of hair that she has on her face. Do you have any itching or burning or pain in your scalp?
Nope. But every time I wash my hair, it comes out in clumps as well.
I can see that. And when you look at Charli's scalp, I mean, I feel for her. She has had severe reduction in her hair density. It's really concentrated right in here.
Yeah, the main part of
The main part of
yeah, like what I want people to see.
So I really think you do have a hirsutism. Hirsutism is when you're having hair growing in areas that we usually see ruled by male hormones, particularly testosterone. So testosterone makes hair grow here because it has a different receptor, but that receptor is different up here. And so it causes your hair to fall out here, but grow here. I know, it's nuts. So the good news is I think we can help you. That's for sure. I think I can help you.
You're gonna make me cry. Okay.
Oh, no. I know, it's hard. It's really hard.
It's been tough.
I bet, no.
I don't even feel like myself anymore, so.
Well, so treatment-wise, we are going to do a couple things. The first thing we're gonna do is start you on spironolactone. We're gonna put on oral spironolactone that helps us to block testosterone's effect on her skin, particularly her hair follicle, which is gonna allow us to decrease her hair growth here and stop her hair loss up here. We need to stop the cause. This is the cause. But I think we should also couple it with laser hair removal.
Okay.
The laser hair removal will allow us to now remove hair that she doesn't want, which is the facial hair that she's seeing, that she desperately wants off. And that takes about 6 to 8 times, once a month or so.
Where have you been my whole life? That's what I want.
Okay.
If Dr. Lopez can actually take away the hair on my face and give me my hair on my head, I will feel feminine again. It would just literally be a new person. Very optimistic. I'm hoping this works.
Charli first came to see me because she was having excessive hair growth on her face and hair loss on her scalp. So Charli's been on spironolactone, which is a medication that blocks testosterone, and undergoing laser hair removal or reduction for the past 6 months. And today I'm about to see her, see what her hair looks like, both on her scalp and her face. Charli! Oh my gosh! Woohoo!
You recognize me?
I don't know who you are.
Before treatment, I was getting bumps from having to wear a mask all the time and shaving all the time. So now that I don't grow hair there, my skin is super clear. I don't look like I have a 5 o'clock shadow like a man. And even when like a little bit of hair does grow, it's so thin that you can't even tell.
Oh my gosh, Charli. There's literally nothing. Like 2.
I left those just for you to see.
Yes, you
I like to rub my face a lot now.
And let's see up here.
I can tell my hair is growing a lot and it looks a lot healthier.
You do have a lot more hair.
Before my treatment, my hair was super thin and patchy and bald looking, and I'm growing my hair out now. You can see I have some thickness going on. I can't walk past a mirror and not be all in the mirror now, so.
This has been amazing to see you being yourself, who you're meant to be.
My transition was from like a woolly mammoth to a goddess.
Neshia?
Dr.
Hi, how are you?
Good.
I'm Dr. Singh, like you said.
Oh, you're even prettier in person.
Stop.
You are.
You started off right. It's very nice to meet you. What brings you here today?
So I have something wrong with my skin. Under the arms, under the
Okay.
breast, or in the genitals.
Sure.
Anyway, I came to get an answer.
Absolutely.
Get a solution.
Let's get you in a gown so I can examine you and I can see what we're getting into. Okay?
I'm ready.
All right, sit tight.
If I get the help that I need today, I will feel like there are such things as miracles.
All right, let's take a look. So you have some active lesions here. You have a lot of,
Scar tissue.
yeah. When I examine Neshia, I see really extensive scarring, in particular in her armpits. Those are areas where she had previous infections, previous inflammation, and now it's all scarred over.
Can I get some hair?
Absolutely not.
No?
No, I'll tell you why. The problem that you have is a problem with the hair follicles.
Oh, so we don't want to bring
No, if one of the ways we treat this or help treat it is to get rid of the hair. This is a hair disorder called hidradenitis suppurativa, where the hair follicles and the oil glands get clogged and you get infection, tenderness, pain, bad scarring. So it's an awful condition and it can be really debilitating. One of the things that make it worse is having hair there. Okay, can we talk about what the plan will be for you?
I came into the appointment excited to learn about ways to grow hair in those areas. But then when Dr. Mina explained the reasons why I shouldn't have hair in those areas, I felt disappointed. But then I understood where she was coming from.
So I definitely feel that you have the diagnosis hidradenitis suppurativa. Individuals with hidradenitis have really high levels of inflammation, scars, sinus tunnels, draining, open skin, wounds. You do tend to have it more in the folds. So right along here, underneath the breast, and then the pubic area. It can affect personal relationships.
It does.
We're gonna try to help, okay? So I wanna start you on a medication to decrease inflammation. I'm also gonna have you just wash with an antiseptic wash because these things can get infected. And then when you have a bump, I'm gonna have you apply a topical antibiotic to that area.
Okay.
Now let's talk about the surgical aspect. One thing I'm gonna do for you today is this de-roofing technique. With hidradenitis, you have these tracts that just hold inflammation, debris, infection, and eventually it all scars over and it tunnels underneath the skin. So the de-roofing procedure opens up the tunnels and we clean the whole thing out and prevent that sinus or tunnel from regrowing. So I'm gonna get you marked and then they're gonna prep you by getting you numb.
All right.
First, I'm gonna start by identifying the areas that I wanna do the de-roofing procedure. So I'll mark those areas and then I'll numb them. Then once she's numb, I'll take a scalpel, peel off the top of the skin, and then take a curette and kind of dig that skin out. No scar tissue. Then get all that gunk out, and then she'll have a clean wound base. Deep breath. You're done. Yay! You're done.
Good job.
Yes.
You did very, very well.
Excellent, yes. This condition goes far beyond just hair. It's not aesthetic. It is a debilitating, painful condition. So my hope is that we helped Neshia today and that from here she can be the best woman, mother, and wife that she wants to be. Hi, I'm Dr. Singh.
Dr. Singh!
Very nice to meet you.
Nice to meet you too.
Come up here to the hot seat and let's talk about why you're here.
Alrighty. I have a skin condition that started when I used to have a beard, a very large beard. I was going to World Beard and Mustache Championships.
Are you serious? That's so cool.
I got a beard championship trophy. I mean, I've done all of that, and I would treat it with lots of different hair products. So by the time I shaved it, I think that I had developed a skin condition, and it just started to spread.
Does the rash prohibit you from wanting to wear the beard at all?
Yes, it does.
Well, I need to see what this rash looks like, so I need you to get into a gown, okay? I'll step out so you can do that. I'm hoping today with Devin that we can just meet his expectations. I want to fix his rashes, and I think I can do a good job with that. Alrighty, so let's see what's going on. I love how you did your gown.
Hey,
Very cute.
Okay.
I love it. But I might say to him, we just gotta get rid of the hair. If you wanna get rid of this problem, just get rid of the hair.
If the doctor were to propose that we have the solution, it's gonna take complete removal of your body hair, that would be really difficult to hear. That would be the worst case scenario.
Okay. Oh, yeah. Yes, yes, yes. So you have these, what we call erythematous, or red kind of scaly patches all through the hair here. Yes.
Seriously, dig in if you want.
I am. Devin does have a lot of body hair. He is a pretty hairy guy. He is also completely bald. Interestingly, both of those conditions were caused by testosterone. So the scalp, if you have hair loss, there are testosterone or androgen sensitive areas that cause hair loss, whereas the beard in some aspects of the body, like the chest, is testosterone sensitive hair growth. Is it okay if I just clip this little portion here so I can see it more adequately and visualize it?
Okay. Whatever you need to do.
Sometimes it's very difficult to examine a patient and to truly see how their rash presents if I cannot see the actual skin. We'll go ahead and start.
Okay.
Okay. And I'm actually, sorry.
No, it's okay.
Does it tickle or does it hurt?
You just go for it. You're fine.
Okay, hold on. Maybe I'll go with the green. Is that better?
A little better.
So what are you wanting to do with the hair? Are you wanting to maintain it? Do you want us to get rid of it for you, or what are you thinking?
I'd like to keep it.
Will Devin have to get rid of his body hair? It really depends on the diagnosis. There are some times where I will recommend reducing the amount of body hair that someone has. And that's if the rash is so significant that reducing it will basically be curative. Okay, so yes, it does look like a form of seborrheic dermatitis. It's caused by an overgrowth of a yeast-like organism. It lives on everyone's skin, but some people get overcolonized. So in order to treat it adequately, we need to address the overcolonization of that yeast-like organism as well as the inflammation, okay?
All right.
But good news, you do not have to get rid of your body hair.
That's amazing.
So the way I would approach this is doing a multi-modality treatment, meaning that we don't just treat it with one thing, but we treat it with multiple things at a time to get a better result, okay? So it's gonna be a combination of oral medications, a foam to apply to the area, and then I'm gonna give you an antifungal shampoo as well. There's nothing really that Devin could have done to avoid getting seborrheic dermatitis. Some people get it, some people don't. It's kind of like acne. Some people get it, some people are blessed to never have a breakout, so this is very similar. After 2 weeks, you should look better. The other aspect of it that is just a little bit annoying is that it is recurrent, okay? Even if we get it perfect and you do not have this for months at a time, it will come back.
Okay.
Okay? So you're gonna repeat these things as needed.
All right. Unfortunately, this is probably something I'll be dealing with over my lifetime, but we're gonna be able to treat it, and they didn't have to remove any hair, so like it's really great. I can't ask for anything more. I really did not want to have to resort to removing the hair, and neither did my wife, I'll be honest, so this is great.
When he comes back, I'm hoping that he has no rash, that he's completely clear, and maybe he'll be more comfortable to grow that beard out, and we'll have like some nice facial hair when we come back. Well, take care. We'll get you going with the medications, okay?
Okay, thank you.
Very nice meeting you.
Nice to meet you too. If this problem goes away, to a degree where it's like it's beyond managed. I'll come back like a phoenix. I will rise from the ashes, go to the world beard competitions. I mean, definitely beard trophy could be in the future. Thank you. Bye-bye.
Bye.
Devin came in because he had a rash that was really bothering him on his chest, on his facial hair. We gave him a treatment regimen. The goal was we would have complete clearance of the rash and that he could finally grow his facial hair back and join the beard gang. Hi, Devin.
Hey, Doc.
Wow.
What do you think, huh?
Oh my goodness, I love the beard. You know, I'm a huge fan of beards, so
Oh.
I'm loving this beard life. Very nice.
Thank you very much. I stopped growing my beard because my face was just so red and irritated. It was just a way to give it relief. Now that I have my beard, I consider it a success. I got a lot of positive feedback from my wife. She loves seeing it after many years of not having it.
So you grew your beard out, so that must mean that things are going well, I'm assuming?
Yeah, absolutely. There's
Okay.
been remarkable improvement. I'm not itching and scratching anymore. I feel like every aspect of me is here again. It feels really great to just be myself again. I just feel the way I used to be, which was sexy as hell, so yeah. I really just want to give you my deepest heartfelt thanks for
That makes
taking
me
care
feel
of
so
me.
good. Devin's wife is happy, he is happy. It's a happy, hairy ending. So now that we have the full beard, are we looking to participate in any beard competitions?
World Champion 2025, it's all possible, so.
I love it. Nelly?
Hi.
Hi, how are you?
Good, and you?
Good. I'm Dr. Singh. It's so nice to meet you. So I go into the exam room and I meet Nelly. She still has her mask on, and I want to be very sensitive to that. I definitely don't want to rush into examining her. Why are you here today?
So I've been suffering from hirsutism since I was like in middle school.
Unfortunately, there are a lot of women who have excessive facial hair, which is called hirsutism. We do see it more commonly in women of African descent. Women of African descent in particular are more likely to be exposed to certain hormone disrupting chemicals, and we have higher concentrations of those chemicals in our bloodstream, and that definitely plays a role, I think, for why some of us are more likely to get that.
It started with just like my sideburns,
Sure.
and then I had like a little bit of a mustache, and so I haven't really had anything like to remedy the situation. My goal today is to get relief from the hirsutism. You know, I've been growing hair for over 20 years, and so it would be lovely to be able to stop that. And I hope when I leave hairless. That's what I want.
I'm gonna go over everything, kind of get a background, but let me take a look first, and then we'll go from there.
Sure,
Okay?
absolutely.
Yes, if you don't mind taking your mask off, I appreciate that. When she took her mask off, I really got to see the severity and the extent of her hirsutism or facial hair. She really has a significant amount of facial hair, and I just really felt for her. How has this affected you kind of overall?
It's had a detrimental effect on my I guess my mental health, you know, because I've kind of become, you know, insecure and just antisocial. Because I mean, it has affected my relationships with men. So
Well, I'm sure it's hard because you have to
Yeah.
have a whole discussion.
I know, and it could be taxing sometimes.
Yeah.
The most recent relationship that I had, we were together like all the time, and so for someone who struggles with hirsutism and shaving and hiding it like that, it was hard because I'd have to get up before he gets up. I got to shave my face. Hopefully I don't cut my face. Now I got to put on makeup to cover the issues. Like, it was a lot. It was exhausting.
You just have the hair growth in a pattern that's what we call androgen sensitive.
Okay.
Androgens, an example would be testosterone. So this is hair that's growing because it's been stimulated by testosterone.
Okay.
Let me have you tilt back up. Ready?
Sure. The term beauty is only skin deep is so true, but it's like we live in such a superficial world. We're all subjected to it. You know, we can't escape it. So it's like that internal fight. It's like, okay, I embrace myself and I'm powerful and I'm this and I'm that. But then it's like, but I do want to be perceived as beautiful. So Dr. Mina, I'm hoping that she can help me because the hair growth is getting worse. It's not getting any better.
Okay, so we got to talk about a lot of things here. So I agree with your diagnosis. You have hirsutism, so that is where the hair is growing in a male pattern because it's been stimulated by testosterone.
If I don't get the help I need today, I would be devastated. I'd be devastated. Yeah.
The standard of care for this is laser hair removal, where we just get rid of the hair. But you have really active hair growth, so we can reduce the number of hairs, but it may not be permanent. But there is a topical medication that decreases the rate of growth.
Okay.
So if you use it in conjunction with the laser, you get a better result.
Okay.
In addition, I do think that you would do well with spironolactone. It doesn't stop the hair growth, but it does block the androgen receptor or testosterone receptor around the hair follicle, which will decrease the stimulus for this hair to grow.
Gotcha.
So doing those 3 things in combination should get you the best outcome.
Okay.
Okay? So I definitely think we can help.
Okay, great.
Yes.
I came in skeptical, you know, of just the type if I was gonna get help. But as of right now, I feel relief because this might change my life.
Yeah. And then after we're done, we have to find you a man as well. I'm a good matchmaker.
Oh my God.
I'm a matchmaker for real.
Oh my God, the pressure is on, huh?
So I'm recommending a cream, a pill, and laser hair removal because my goal for her is to make it so she feels comfortable without having to shave or doing anything else to remove the hairs, and she can go out. I know she's looking for a man. I can't wait for her to find a man. I would like to go to her wedding, so that's my goal with her.
Oh man, this is crazy.
First thing I'm gonna do is shave you. So tell me what areas we're actually doing.
You're doing all of it.
All of it.
But save my eyebrows, don't do my eyebrows.
Okay.
When you're treating a person for laser hair removal, first you have to actually shave the hair down. And that's because the laser is directed at pigment. If the hair is already out of the skin, then it's gonna just buzz the top of the hair, but it won't prevent it from growing back.
Our little theory is ditch the razor for the laser.
All the hair had to be removed, so they dry shaved me, which was kind of uncomfortable. But right now I'm just nervous about the laser since I heard it has some pain involved, especially considering the amount of hair there.
So how the laser procedure works is it targets the hair bulb. So we try to cover the entire area, but it will hit the hair in different phases of the hair cycle. So some hairs may be gone after just this procedure, but it may take several sessions to get rid of all of the hairs. All right, you ready for me?
No, yeah.
I promise it's not gonna be that bad.
Okay,
Yes, yes. We're gonna do kind of a test spot first, okay? Make sure that you can tolerate it, okay? You just let us know. You do okay?
Yeah.
Okay, we're gonna keep going. Let me know if it's hurting a lot, okay? She was really nervous about possibly having a lot of pain with the laser. So what we did was I made sure the skin was as cool as possible. So I went over her skin with a roller that was cold, cooled the skin down before I even started, and then did the laser, and then came behind it with a cold roller and then ice packs to decrease the heat.
So the laser initially it hurt. It was uncomfortable, but I realized the more that they made it cold prior to actually doing the laser, it made it where it didn't hurt as much.
Okay, we are done. Just cooling it down some more. You did okay?
Yep, I'm good.
Okay, as soon as he has, I know you did fantastic. Nelly tolerates the laser hair reduction amazingly. She does really well. I think she's gonna have a great result, but it is gonna take more work. She's gonna have to continue to do monthly treatments until the hair is significantly reduced. That can take anywhere from 6 to 9 sessions and sometimes more.
Thank you so much.
I'm so glad you came.
I appreciate you.
So Nelly's coming in today, and I'm really excited to see if our treatment plan worked. When she first came, she had a full beard, and so I'm hoping that she does not any longer. Nelly?
Hey!
Hi!
How
Oh
are
my
you?
goodness, you look great.
Thank you.
I mean,
I feel great.
wow. As I enter the exam room, I see Nelly, and all her facial hair is imperceptible. She is glowing. Her energy is completely different, and it makes me so happy. So how many laser sessions have you had thus far?
I think I've had 8.
And so have you had a pretty significant reduction in the amount of hair growth so far?
Oh, absolutely. Less hair each and every time.
Wonderful.
Don't really shave in between. There's no need for it, so.
Good, that tells me a lot because you were having to shave pretty frequently before.
I've responded really well.
Yay!
The worst part about being a woman with a beard is not feeling like a woman. With the hair gone, I feel like a woman now. I feel authentically beautiful and not just trying to constantly convince myself to feel like I am beautiful.
How's the dating life going?
Good. I have a boyfriend.
Oh my gosh. I'm happy for you.
Thank you.
That's amazing. So does he know like this whole journey, or is he just, really?
So I showed him the pictures and stuff like that and just told him, like, educated him. And so he's really supportive.
Oh my gosh, I love that.
I'm grateful, yeah.
You are no longer single and the facial hair is almost completely gone. 6 months later, that's a pretty good turnaround.
I know.
That makes me
How much
happy.
things can change that quickly.
I know.
Crazy how something that affected me for over 20 years is now like not even an afterthought. I don't think about the hair. I don't cringe if someone reaches to touch my face. I'm no longer feeling as if I'm defined by hair, you know, so that's the gift that's been given.